Hi, Mr. Torres. How are you?
Hi.
My name is April.
Hi, bro.
I'm going to be your nurse today.
Sure.
How are you feeling?
Doing good, thank you.
What brings you to the facility today?
Well, I'm just here for my annual checkup for work that requires us to have this every year.
Okay. Well, I'm going to do a little bit of an assessment.
Okay.
I'm going to ask you some questions.
Sure.
And then we'll do an assessment, kind of a quick head to toe.
Sure.
That way I can let the doctor know what I find.
Okay.
And if there's anything specific that I forget, just make sure you let me know and I'll make sure that I tell him or her, whoever's on call. I'm not
Thank
quite
you.
sure yet.
All right.
Okay?
Thank you.
All right, so a couple questions. I'm going to check your name band.
Sure.
Can you tell me who you are
My name is Eric Torres,
and your date of birth?
5369.
Very good. So I'm checking name and date of birth. That's perfect. Can you tell me where you are?
I'm here at Mountain Vista Hospital.
Do you know what day it is?
Sure. It's the 29th of June,
Good. How about the year?
2016.
And who's the president, whether you like him or not?
Yes, Mr. Obama.
Okay, good. Alert orientation questions. All right, so nothing, you're here for work stuff.
Yes.
Do you have any past medical history?
Hypertension, high
Okay.
cholesterol.
Okay. What medications do you take every day?
I'm taking losartan, 25 milligrams daily, and just omega-3.
Okay, so no meds for the cholesterol, just
No.
the omega-3?
No, my
Okay.
doctor told me I don't need to take the lipids or just
Okay.
omega-3 will do.
Okay. How about any surgeries? Have you ever
No.
had any surgeries? No
No.
surgeries? Wow, good job.
47.
Hey, there you go, that's good. Okay. How about smoking, drinking, or recreational drugs? Do you smoke?
No.
No cigarettes? Do you
No.
drink
Very, very rarely. I mean,
once or twice a year, once a week?
if that, once a year,
Once a
perhaps, yeah.
Okay. Because he's not a drinker that would encourage me to ask cage questions, I'm not going to. If he had told me 2 a day, then I would ask cage questions. Kind of talking to my students at the same time.
Sure.
Do you use any recreational drugs?
No.
Do you feel safe at home?
Yes, ma'am.
Okay. Do you have a good support system at home? Do you?
My girlfriend, which is good.
Okay, good. All right. Want to make sure I address those questions and get them out of the way. How often do you see your primary care doctor?
Not very often because I don't have the need for it, but
Okay.
I mean, I have to have a primary care doctor. Everybody should, but I see it maybe once a year, twice a year.
And you can afford medications?
Yes, ma'am.
Okay, perfect. All right, so we're going to go ahead and begin. We're just going to kind of work my way down from your head to your toes. If there's something that hurts, please let me know. And I guess if you're here for just a checkup, but just in case.
Yeah. Thank you.
Perfect. I'm going to grab some gloves. We're going to play a little game. Are you okay with playing a game?
Sure.
Okay.
Is there money involved?
Yeah, you don't win anything unless you want me to pay you in chewing gum.
Sure, I'll take that.
All right, can you smile for me? Good. Stick out your tongue. Can you puff out your cheeks? Both. Can you look up and down and side to side? Good. You can let your cheeks go. Very good. How many fingers am I holding up?
5, 2, 5.
Perfect. Can you keep your head straight and kind of look at, you can keep your head straight and then just follow my fingers, okay? Looking for a nystagmus as you do this is kind of when your eyes jump. Perfect. You see my fingers here?
Very good.
And so I'm going to bring them, kind of make you cross-eyed for a second, okay? Good, perfect. All right. Are you okay if I shine a little bit of light in your eyes?
Go for it.
All right, so go ahead and look straight. Bring some light in. Okay, and a little bit more light. Good. Your pupils are great. They're about a 3, which is a normal size, or within our diagnosed limits. They come down together and they go back together, so they constrict and dilate, and that's called perla.
Perla, I'm good.
Wonderful. All right, can you feel me? I want you to close your eyes and tell me if you can feel me touching you, okay?
Yep. You're running your fingers on my face. On my
Okay.
chin.
Don't fall asleep.
No.
Can you feel all that?
Oh, yeah.
Good. Okay, that's good. You can open your eyes. All right. Let's take a look into your mouth while I'm up here on your head. I'm right-handed, so I apologize. I keep walking back and forth. I'm going to have you open. I'm just going to look at the interior of your mouth. I'm looking at your teeth and looking at your mucosa. That partially tells me about whether or not how well you can eat,
Okay.
and if
Well,
your
you
mouth
can
is
tell
super
like
dry.
I'm fine.
You eat good, right?
I eat good.
All right, mouth open. Good. Pink and moist. All your teeth, you had some dental work done?
I
Yeah?
did crowns put in.
How often do you see a dentist?
In fact, I'm gonna see him today. He's gonna take the temporary crown over here and he's gonna put a new one to me.
Oh, wonderful. Good.
I do, I got a good one.
That's good. I believe you. I believe you're telling the truth. All right, can you push your head up against my arm? Good. And push your on the other side? Good. Can you shrug your shoulders? Good. That's good. If he was having any ear complaints, I would look inside his ear. It also happens my Welch Allen is not working. But when I assess ears, remember pin it up and out. In an adult, pin it down and out on a kid. I'm gonna notice his scalp and look. I can, if I need to, rub mine. He's got stuff in his hair and I don't wanna mess with anything.
Oh yeah, don't mess my head.
Any pain as I touch there?
No?
Okay. Remember, we have lymph nodes all across here
Yeah.
and out and about.
Alright.
Any pain there?
Nope.
Okay, perfect. So, if I had alcohol wipe with me, which hopefully I would have, to test your olfactory, I would have opened my alcohol and been able to smell. Do you smell anything funky while you're in here? Oh, look, somebody has alcohol for me.
Join
I
me on the
love
spot.
that. That's my student. Woohoo! Go Stuart! Okay, so go ahead and close your eyes for me. And can you tell me what you smell?
Alcohol.
Good. And so you can open and that's alcohol. And that's your olfactory nerve. 8 is the vestibular, which is hard to tell, to check with a specific test, but you're answering me appropriately, so I know you can hear what I'm saying. 3, 4, and 6, you've already moved your eyes. 5 and 7, you've done, and your glossal swallow. That's essentially your 5 and 7, and then 9, 10, 11, and 12. Okay, we tested already. All right. Can you uncross your legs for me? Good. I'm gonna have you squeeze my hands. You keep your hands straight. I'm gonna cross my hands. Keep wanting to get in front of that camera. And go ahead and squeeze. Good. I'm testing your grips and your strengths. Can you pull me towards you? Good. And push me away. Good. Same for your feet. Can you push me? Good. And pull your toes to your nose. Good. Okay. That's perfect. I'm going to change my gloves since I was touching your feet. I'm going to listen to your lungs, your heart, and your belly, if that's okay.
Yeah, sure.
Okay. Can I have you sit maybe with your feet over on that side?
Sure.
Perfect. I'm actually going to set the head of the bed down and have you almost kind of turn catty corner so that my students can see where I'm listening on your back.
Okay.
Turn the other way.
Oh, the other way.
Yeah, there you go. Sorry.
Yeah, sure.
Okay. Do you see me from there? All right, when I put my stethoscope on you, I'm going to listen to you in a specific pattern. I want to have you take a deep breath, but I'm not going to go so fast that I make you hyperventilate. Okay? All right. Here we go in the back. 6 spots, guys. Okay, so deep breath. Good. Good vesicular sound. Good. 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 One more back here. Good. Nice, good vesicular clear sounds, which means you're getting plenty of oxygen you need. No gunk, I don't hear anything in there, no wheezes.
I don't smoke.
Good. Any pain as I palpate here? Spine nice back down your back. Perfect. Skin is nice and warm as I touch. Dry, I don't see any diaphoresis. All right, I'm gonna switch you back to the front now, if that's okay. You can relax, I'll give you your pillow back.
All right. Lay down.
Lay down.
Okay.
Lots of movement, sorry.
Oh, that's fine. Never mind.
All right.
Here, fix my pillow like this.
Let me fix your pillow, however you want it.
No,
Put it
just
back on
fold.
your
No,
back.
no, fold it.
2.
Thank you.
How's that?
Yeah, that's better. Thank you.
going to listen to some lung sounds in the front, and then I'm going to go to your heart.
Okay.
When I listen to your heart sounds, I want you to just breathe normal.
Okay.
Okay? Deep breath. Good. Again. 2 more, okay? Good. Perfect. Nice, good, clear lung sounds. I'm going to listen to your heart sounds now, okay?
Just breathe normal. Okay.
Should be normal.
Okay.
Right? Do you know if you have any murmurs or extra heart sounds? Ever been told
I
that?
don't think so.
Oh, okay. So I'm going to listen in a specific format we call ape to man. So I'm going to just count it out as I go. This is
Sure.
going to be your aortic, about second intercostal space, left sternal border, or right sternal border, sorry. The pulmonic valve, which is another valve in your heart, is on the second intercostal space, left sternal border. The E, or Erb's point, is the fourth intercostal space, left sternal border. The T is the tricuspid, which ties to your tricuspid valve, which is in between your right and left atrium, or right atrium and right ventricle. And that's the fifth intercostal space, left sternal border. And then your apices of your heart, which is kind of the point, which is the fifth intercostal space, mid-clavicular line. Okay? So here we go with 8. Just breathe normal, please. And here we go, left up, left up, left up. This is the pulmonic. Erb's point. Tricuspid. Good. And I'll come down to the apices of your heart. Perfect. I don't hear any extra heart sounds. I don't hear any murmurs, which is just turbulent blood flow.
Thank you.
If this gentleman was female, I would ask him to lift his breast so I wouldn't have to. Okay? Perfect.
Well, thank you.
Can you put your arms out for me? Perfect. Just relax. I'm just going to feel your radial pulses. Just compare them side by side. Good. 2 plus. I'm going to kind of pinch your finger. Is that okay?
Go ahead.
Assessing for cap refill. Holding for 5 seconds. 1, 2, 3, 4, 5. Let it go. Cap refills is less than 2. 5. Less than 2. Perfect. Numbness or tingling in your arms at all? No. Can you hold your arms up for me like a tray? Good. Close your eyes and keep your arms up. No dread. Can you touch that finger to your nose?
Oh,
And bring it back. And that finger to your nose and bring it back. Awesome. Okay. You put your arms down, you can open your eyes. If I was assessing for cranial nerves for a stroke, I'm looking for drift. Droop in his face, which I did not see. Face is symmetrical when he smiles and just kind of that baseline. That's a good thing. Abdomen, you ready to cover your stomach?
go ahead.
Okay. We're almost to the lower part. Yeah. So we won't go to that part.
Oh, I know.
All right, just gonna breathe normal.
Okay.
It's the right lower quad. Nice, good bell sounds. Right upper quad. Left upper quad. Left lower quad. Perfect. This, of course, takes place after inspection to maintain modesty of my instructor. I'm not going to have him show his belly. I already know his skin is symmetrical, it's intact, there's no incisions, clean and dry. Are you okay if I go ahead and touch now?
Go for it.
Okay. You tell me if there's any pain.
Mm-mm.
Light palpation first, and then a little bit of deep palpation. I have to be able to check for masses. Any pain there?
Nope.
Okay, perfect. We're now moving down to the bottom. We don't do anything that's genital unless he's complaining of that area, which he's not here for that reason, so we're not gonna go there. I'm going to, let's spray here. As I touch, Anything hurt?
Nope,
How about down here in the bottom?
nope.
Can you pull your toes to your nose? Are you having any pain, numbness, or tingling back here? So I'm checking for a Homan sign to see if maybe I have a potential for a clot. If it's negative, that's good. That means it's normal. I would take off his socks and be able to look at his feet to be able to check cap refill on his toes. They should be the same as his hands. I'm also going to look for dorsalis pedis pulses. Both are 2+ equal bilaterally. I can look for posterior tib, not my favorite, which I told you guys that. But you can palpate them there as well. Popliteal would be underneath the knee. Okay. I think we're done.
Thank you.
Do you have any questions, comments, or concerns for me?
Nope, I'm good.
Okay.
So
Thank
next
you
year.
for letting me do an assessment on you. I'll let the doctor know everything sounds good. Your lung sounds are clear. Your bowel sounds are clear, nice and good and active.
That's encouraging.
I would usually listen for a full minute, but because I hear them, I'm just gonna go to each different area. Heart sounds are within diagnosed limits. I hear you everywhere I'm supposed to. I don't hear any S3, S4, what we call extra heart sounds. And I don't hear any murmurs, which sometimes that means blood would be going back and forth between
Yes.
your atrium and ventricles, and I don't hear that.
Okay.
Completely answering me appropriately. I love it.
Thank you.
Yeah.
All right.
Your eyeballs, your sclera is nice and white,
Yeah.
which is beautiful. I'm not looking for any, no signs of jaundice. Oral mucosa is nice and pink and moist. Lips are not dry. Pupils are normal size, 3+ bilaterally. All your cranial nerves are intact.
I'm good for another year.
Yay!
Yay.
Oh, bowel patterns and urinary patterns.
No problem,
So, how many times a day do you usually pee?
sir. Several times. I don't count.
Okay.
I go.
Clear, yellow, any stinky,
Nah.
any pain?
Only when it's asparagus.
Yeah, asparagus will make that
But
happen
that's
as
the only
well. It does for girls too.
I know, right?
I don't know what that is.
I think it's is it that sulfur or something in there? Is
I
it
don't
sulfur?
know.
I got to.
It might be, we'll have to look it up.
Yeah. But that's the only time.
Okay, so, and no other odor, it's clear yellow and no blood.
No.
Do you get up at night to pee?
Very often.
Not very often, okay. That would be a good question if I'm assessing for crossing. How about bowels? How often do you poop? When's the last time you pooped?
This morning.
Okay, poop every day?
I try.
Okay, well that's good.
Yeah.
Everything kind of normal, soft and formed? No diarrhea?
Unless I get a Filiberto's, but I try to not.
No,
eat
you
there.
said you don't like
No, I
Filiberto's.
wouldn't even fit it to my
I've been told it's fill your buttholes, but
Yeah, it is, yeah.
you never know.
Yeah, even my dog wouldn't eat it.
Everything working down here.
Everything is fine.
Sexual performance is fine.
I don't have any complaints.
Okay. Difficult question for people to ask, but it's important. It's part of your health assessment.
Oh, yeah.
I cannot think of anything else I am missing. I think we nailed it all.
Excellent.
Thank you so much.
Thank
You've
you.
been a great patient. I'll let the doctor know everything's okay, and he'll come in and probably do the same thing, but just a little bit faster.
Alrighty.
Okay?
Thank you.
Thank you.